So this procedure is for the scapula. I am going to do an AP and a lateral scapula. Mary, so what brings you in today?
Oh, I fell, and I fell backwards, and I hit the back of my back, and it's very painful. And my doctor sent me in to get it x-rayed.
Okay, so I'm going to take 2 x-rays. So you're saying the pain is in the back of your shoulder back
Yes.
here? Okay. All right, so the first x-ray I'm going to be doing is you're going to have to put your back against the wall bucky, this white thing there. Perfect. I know you're in pain, so I just need you to lightly touch the back of the IR or the bucky there. Very good. And Mary, can you step a little bit to your left for me? All right, so for an AP scapula, I want to use a 40 SID. I want to have a collimation of 10 by 12, and I want to place my central ray about 2 inches below Mary's coracoid process, which is about here. The coracoid process is in the scapula. So I'm going to make sure that I kind of know where the area is and adjust to that. So about 2 inches is right about there. Mary, I just need you to step a little bit to your left. Very good. Okay. Good. All right. I know this is maybe a little painful, but I'm going to need you to raise your hand as if you were going to do a salute and place the palm of your hand on your forehead if you can. Nice and slow. Very nice. Okay, very good. Okay, I have my right marker and my lead shield in front. For this position, Mary, all I need you to do is stay very still and breathe nice and shallow. So I'm going to be using a breathing technique. This will allow me to blur out the ribs, and by bringing the arm up is bringing the scapula away from those ribs. All right, Mary, I am going to step away and just breathe normal. Good? All right, you can relax that arm. So what I'm going to do next is I'm going to have you turn around. This time you're going to face the board. The next projection is going to be my lateral position. So since she's complaining of pain of the body of the scapula, I am going to bring her arm across her chest. This way the scapula protrudes out. So Mary, what I need you to do for this is bring your arm across your chest, your right arm across your chest like that. Very good. All right, next I'm going to position her at a 45 to 60 degree angle. Good. That shows the scapula in a lateral position. I'm going to turn my light on so that I can adjust my center to the body of the scapula. So Mary, I'm going to need you to step forward towards me. Adjust that a little bit. Just need to go on the other side. And yes, x-ray techs do go under the x-ray tube a lot of times. Mary, okay. Come back a little bit towards me. There you go. All right. And go forward. Very good. Right there. Beautiful. Okay, now I'm going to place the shield behind you, Mary, so don't step back. And I still have 12 inches lengthwise, but if I wanted to, I could collimate in a little bit side to side, just an inch past the scapula. For this position, Mary, I am going to need you to hold your breath. So hold your breath. Don't move. Good. Now you can breathe, Mary, and you can relax your arm. Now, if she had complained of the pain in the front right here, for this last position, the lateral, I would have done something a little different. In that case, Mary, I'm going to have you go in the same position you were in before. Okay. And this time, I'm going to need you to bring your arm behind you, all the way behind you. What that does in this case is it brings the coracoid process in the front closer to the image receptor. And I would have her hold her breath again. Hold your breath. And you can breathe. Thank you, Mary. You can relax your arm. Smooth that away. I am going to demonstrate how to do AC joints. Mary is my patient, and I brought Mary in. I checked her ID. I verified her information, and I also verified the script. So Mary, can you tell me why you're having the x-rays today?
Yes, I injured my shoulder lifting a heavy piece of equipment. I have a lot of pain in my shoulder. Now I can't raise my arm very high. And the doctor wants me to get an x-ray to see if there's any injury to my arm.
Okay. So although she has pain on the left shoulder, the script says AC joints. The first thing I'm going to do is take an x-ray of her AC joints without weights. So Mary, can you just please come over here to my board, and you're going to place your back against that board. Perfect. Okay. Now for this procedure, I need to use a 72 SID, and I want to adjust my bucky, and this is going to move behind you, Mary. I apologize. I'm going to move my bucky to the level of her AC joints, and they're right here. Obviously, she would have changed. No bra, no jewelry, no artifacts for this procedure. And I like where that is. So now what I'm going to do is adjust my x-ray tube to the level of my bucky and center that. And now that I'm there, I'm going to ask Mary to step a little bit to the right, to your right, that way. A little less, come back about a ½ inch. Beautiful. So I want to be at the mid-sagittal plane because I'm doing bilateral AC joints. I want to be at the level of the AC joints. And last but not least, I am going to place my shield in front. Now, Mary, when I walk out of the room, all I need you to do is stay very still and hold your breath.
Okay.
I am going to step out now. Mary, hold your breath. Okay, you can breathe and you can relax. Now, if the patient's condition allows me to do the next step, I will. So basically, I'm going to make sure that there are no dislocations or fractures so I can do the next step. The very next step is exactly the same. The position is going to be the same. What I'm going to do is put weights around Mary's wrist, but I don't want you to hold them. So you're going to have to hold them like this.
Okay.
Yep. These weights should not be more than 10 pounds. The reason I don't want her to hold the weights is because I don't want her to elevate her shoulders. And that's what I'm doing right now. I'm going to check, make sure she did not move from where I left her. I have my right marker and left marker to indicate both sides. And then I'm going to give her the same breathing instructions and step out of the room. Mary, once again, just hold your breath. Okay, you can breathe. I've taken the exposure. I'm going to take those weights from her and make sure that she's comfortable. I'm going to move this out of the way. And that's it for AC joints. I just want to mention that when you are setting up your patient, that they're standing nice and straight, because we are comparing both of the joint spaces and we want to make sure that they are as even as possible. So this time I'm going to show you how to position for a clavicle, and I'm going to take a couple of x-rays. Again, I have verified my patient's name, their information, and also the side. Mary, what brings you in for x-rays today?
I have very severe pain in my left shoulder. I was playing with my grandchild and I fell, and I think I really hurt it badly, and my doctor wants me to get my shoulder x-rayed.
Okay, so we're going to bring you over to the board right here so I can position you for your x-rays. Mary would have changed, again, for these procedures. opening in a gown with the opening in the back. She would have removed her bra, any jewelry, any artifacts, so that they don't show up on the x-ray. Once the patient's changed, I'm going to position her. The first projection I'm going to do is going to be an AP of the clavicle. Now, I could also do a PA, but if the patient is in pain, you don't want to put that clavicle against the bucky, so I am going to do it AP instead. Mary, is it your left side that hurts? Okay.
Yes.
So I have my left marker there. My collimation is going to be 8 by 10, crosswise this way. And I am going to place my central ray at the level of Mary's clavicle. So the first thing I want to do is adjust my tube to about the mid shaft of the clavicle, which is around between the sternum and the acromion right here. So I'm going to lower that a little bit. And it is her left, so I'm going to have her move over to the right. And I want to make sure that I include both joints in this x-ray, and I do see that because I see that I have the sternum and a little bit of the shoulder. Okay. Since I moved that, I'm going to adjust this a little bit behind you, Mary. All right, and I'm going to move the shield in front of you, so be careful. And when I step out of the room, Mary, all I need you to do is take a deep breath in. You're going to blow it all the way out, and you're going to hold your breath. Okay, Mary, take a deep breath in, blow it all the way out, hold your breath. Okay, you can breathe and relax, stay right where you are. The reason we want to take the exposure on expiration is to lower this end of the clavicle so that it's at the same level as the other end, the sternal clavicular end. Okay, the next projection, I am going to ask my patient if they can do the lordotic AP-axial position, and if they can, I'm going to proceed. But if they can't, then there's another projection which is non-lordotic. Mary, do you think you can step forward for me about a foot or so? Good. And then I'm going to don't do it just yet. I'm going to have you lean back. Is that okay?
That's okay.
All right.
I can do that.
Okay. So before I have her do that, what I want to do here is adjust my x-ray tube. This time I'm not going to use a perpendicular beam. I'm going to use between 0 to 15 degrees cephalic. So I'm going to adjust that, and this is going to change. And that should be good enough. I'm still at 40 SID. I'm going to lower that a little bit. Okay, Mary, right now I'm going to have you lean back as much and keep going. Step back a little bit. Shuffle your feet. Okay, good. Go back all the way. Good. And again, I'm going to be centered to the clavicle, entering at that level. Right about there. This is going to move behind you, Mary, just a little bit. Okay. All right. Bring my shield in front. Mary, this time I'm going to ask you to take a deep breath in, and you're going to hold it. Okay? All right. Right now, I'm going to step out of the room. Mary, take a nice deep breath in and hold it. Okay, you can breathe and relax. The reason we take a deep breath in is because we want to bring the clavicle further up above the apices of the lungs. Now, if Mary had not been able to do this projection, if the patient is unstable or you have an elderly patient, you may just want to keep the patient right up against the board and increase your angle to 15 to 30 degrees instead. So in this case, I'm going to increase my angle. And then I'm going to recenter that. Be careful, the light's going to come on, so you can close your eyes. We don't ever want to put the laser on the patient's eyes, okay? And I'm going to, again, recenter to Mary's clavicle, her left. Adjust her a little bit because she's a little bit to the right. Come back a little bit towards me. Very good, nice there. And then I'm going to adjust my bucky. This is going to move. Okay, I have my marker. I have my shield. And I'm going to step away. Mary, same thing, same breathing instructions. You're going to take a deep breath in and hold it. You can breathe. And that concludes our presentation for the clavicle.